speak for myself, right? Evaluation of herpes simplex virus in patients attending tertiary care center. Coming to the introduction, infection with herpes simplex virus, commonly known as herpes, it can either be due to HSV type 1 or type 2. HSV1 is mainly transmitted by oral contact and it can cause oral herpes, also known as cold sores. This can also cause genital herpes. HSV2 is an STD which will cause genital herpes. Both these infections are lifelong. They have a unique property of latency where they will reactivate later in life and cause recurrent lesions. According to WHO, an estimated 3.7 billion people under the age of 50, that accounts to 67%, have HS1 infection globally. An estimated 491 million people who are aged between 15 to 49%, that accounts to 13% worldwide, have HSV2 infections. Most of these oral and genital herpes infections are asymptomatic. In the India, HSV2 seroprevalence rates will range from 7.9 to 18.9%, that accounts to 100 to 200 million individuals who have acquired HSV2 infections. Coming to aims and objectives of my study, aim it is to determine the proportion of HSV infection in patients attending tertiary care center. To the objectives, it is to assess the proportion of HSV associated encephalitis, to determine the proportion of pyrexia of unknown origin, HSV associated torch infections, and other minor infections such as hematological abnormalities such as pancytopenia, thrombocytopenias. Coming to materials and methods, the sample size is 247 patients, of which 160 are children and 87 are adults. These 247 patient samples of suspected HIV infections that were sent to the microbiology lab were subjected to HSV IgM ELISA and they were analyzed. These suspected samples received were categorized into different groups based on the diagnosis, such as encephalitis, torch infections, pyrexia of unknown origin, pneumonia, genital ulcerations, hematological abnormalities. The type of samples received: 180 serum samples, 45 CSF, and for 22 patients, both serum and CSF were sent. This is the ELISA kit, which is Cal Biotech kit used for HSV. It detects type 1 and type 2 both. Coming to the results, of 247 patients tested, 44 were found to be positive. That accounts to 17.81%. Males and females are equal, so it is 50% of both of them. And coming to HSV, HSV alone causes 52% of infections. And HSV along with other viruses will cause around, the positivity is 48%. This is the gender-wise and age-wise distribution of the infections. 0 to 15 years had more number of cases where males may predominate. That was followed by 16 to 30 years age group where females have outnumbered the males. Very few cases in 31 to 45 year age group and no cases in above 45 years. This is the prevalence of HSV infections. This table shows the HSV infections, co-infections, and their prevalence. More number of encephalitis cases were caused by HSV alone, and along with other viruses such as CMV, Japanese encephalitis, EBV, were caused in 10 patients. And pyrexia of unknown origin was caused by HSV in 2 patients, and co-infection with other viruses was there in 4. Other infections, minor infections, were caused by HSV along with other viruses as co-infections. This is the encephalitis, which is shown as age-wise distribution, and along with the co-infection, more number of HSV encephalitis cases were caused by HSV alone, and less were caused by co-infections. These cases were higher in 0 to 15 year age group, and followed by 16 to 13 years. The median age for the children was found to be 5 years, and for adults it was 21 years. Coming to the discussion, study done by Panagria et al. Shows males were more than females, but my study has shown males and females were almost in equal proportion. The study done by Farzana K. Beek et al. Has showed the proportion to be 10.5%, but my study has shown the encephalitis proportion to be 11.11%. Study done by Sandeep Kumar Tripathi et al. Has shown more number of cases in 5 to 15 years. My study has shown more number of cases in 0 to 15 years. Coming to the conclusion, this study shows the rising trend of HSV-associated encephalitis among children. This will reflect the need to increase the screening among children and their caretakers for HSV. CSF samples to be tested for all the encephalitis cases, and also other investigations such as CT, MRI, EEG of brain are also necessary to diagnose the infection to reduce the mortality and morbidity. Some of the conditions like pyrexia of unknown origin, hematological abnormalities, viral pneumonias should be extensively tested for other viruses. This study is having a lot of limitations, bigger sample size, extensive clinical data, and other higher investigations at cellular and molecular level are necessary to design proper prevention strategies, and also it shows the need to develop the vaccine.